Hi, everyone. This is week 4 assignment, working with multidisciplinary teams, discussion and summary. My name is Amelia. We'll have Jingjuan next, Christia and Natalia presenting. So the benefits, for the challenges of working with multidisciplinary teams in community and mental health care, one of the challenges that we do see is coordination and establishing roles for a client with all the different uh, titles that we'll be working with, like therapist, sometimes psychiatrist. Um, there can be not clear-cut roles in that sense, and also like communication barriers, like one area like a social worker might not understand what a psychiatrist may be talking about in terms for the client. Those are some of the challenges that we that might show up in a multidisciplinary team.
Yes, for sure. Besides those challenges, like how you gain clients' trust, when so many people can accessing their like private, confidential information, like well, they feel comfortable to be totally open and to be honest with the team. I think that is also one challenge, how to build up the trust and not like create like gossiping or HIPAA violations.
One of the benefits for multidisciplinary teams in community mental health is providing our clients with comprehensive care. So by having all these different disciplines, integrating to do what's best for the client, right? So this could be therapists, counselors, social workers, educators. So having one group that has this common goal, which is for the client to be successful, is one of the benefits. Another one is collaborative problem solving, right? By combining all these different expertises, we can get more effective intervention strategies and treatments for our clients.
Yeah, I definitely agree. I think also another benefit um of utilizing multidisciplinary teams in community health is that um it just enhances client outcome in general because all the specialists are working together for the benefit of the client. And it's more of a targeted intervention. Or sorry, there's more targeted interventions. They're addressing kind of the same issue as opposed to one is addressing this or another one's addressing that. Um, and then another benefit is just the support network. Um, it just creates a support team for the client. Um, so it's just instead of having the client kind of go all over the place and be all scattered, it's more centralized where they can kind of get help from everyone.
Working collaboratively with a multidisciplinary team can impact confidentiality, like just sharing really sensitive information amongst each other can be sort of difficult, especially if the client tends to talk more about certain things to one part of the team, right? So it's like um, being able to share that information, letting the client know that this information is shared. In my previous work, I've had patients that would staff split, like sort of talk to the therapist more versus the social worker because they didn't have a good therapeutic relationship. But everyone in the team needs to know that. Or like reporting one thing to the psychiatrist for specific medications, but reporting another thing differently to a psychologist who's also on their team. So and being able to share that and let the client know, like, hey, like this is what's going on, can be really, really uh, difficult because it could impact how the therapeutic relationship is overall with the team.
Mm-hmm. Agree with that, and how it impact confidentiality policy is it's like, I don't know if it's easy for clients to trust everyone working in the collaborative team will have the same ethical holding to HIPAA. Like if like there's a very big organization like Kaiser, so many people work there, and then they may not feel safe if they know that they're like friends who is like gossiping, working there, and then they may not be able to share honestly and that openly. So that may harm the therapeutic relationship in between the therapist and the clients, even though the therapist will keep it very confidential, but like when it goes like to the whole team, it's just like not always in control.
Yeah, because I think that with our clients, right, they need to feel like they're able to trust us, right, as the therapist. And even though we do need to share sometimes even like sensitive information about that, we have to be careful that we're not divulging, HIPAA, like she was saying, right? Because some of those things are laws, right, and regulations that we have to abide by. But more importantly, also the therapeutic alliance, right? So we do need to share some of that information, and it might be difficult, right, when we're working with all these different teams and all these different collaborators, right? Because we're again trying to do the best for our clients. But I think it is kind of difficult, right, to make sure that happens, and more important that we keep that confidentiality, and that we only share only the pertinent information that those people or those different types of resources need, so that way we are keeping intact our boundaries with our clients and with them.
Yeah, I completely agree, and I think that um, just like how everyone was saying, there's that balance of sharing and privacy and confidentiality, and that can definitely impact the therapeutic relationship. Um, I think this is why it's just super important that there is that established protocol and that um, communication within the teams so that they can navigate these challenges of like what is shared, what isn't shared, and not overstep those boundaries. Like I think that's just very important that they are all working collaboratively together so that they aren't overstepping or oversharing things that they don't need to know for what they're doing for the client.
So for maintaining confidentiality and trust in a therapeutic relationship, while also having the client-centered advocacy, it could be I can imagine it being very difficult, but as long as like there are clear, um, it's very clear to the clients and to the team of, HIPAA violations, how important HIPAA is, the sensitivity of the information. Just like the protocols for confidentiality are spoken about and are understood. I think it's important for clients to actually understand that. And it may have to be in like layman's terms too. Uh, that is something that I could see, like, just to make sure that the confidentiality and the trust is there. It's important too. So in my previous work, like the team would, everyone in the team would have to show up for the client. So just being able to maintain that confidentiality and trust, it would be important for every team member to be there too, because that's the best way to get the information rather than secondhand, right? So that way we understand what the client is saying. We can discuss it later on without thinking like, I'm getting the client's information from someone else. I'm seeing it firsthand. So I think it's very important that each team member shows up for their client, to avoid any issues in confidentiality, what should be shared and what shouldn't be shared.
That is a very nice approach. For another thing I'm thinking is, for us as MFT, we can share limited information to other teams. maybe only the necessary part that will benefit the other teams in taking care of the clients, but may not be like sharing all the details to them. And the system can also create some different access, maybe for different teams, to make sure the confidentiality is protected. And I heard there's something like called like break the glass thing, like they can use. So whoever wants to access like those confidentiality information, they have to put a valid reason to justify their they want to access that. And the last one I'm thinking is to for the whole the team to establish a accountability system. So there are people like regularly check if someone is violating the HIPAA. Those behaviors can be caught and can be corrected.
Yeah, those are good systems to have in place. I think for me also to add on to that would be making sure that I have very clear communication with our clients, right? Clear boundaries, and that they also that I myself have a clear understanding of what they're understanding, right? Because sometimes we might say something, right? And they're like, yeah, but so to make sure I check in with them and have that communication, right? Of like, do you understand that, for this particular team, I may have to disclose X, right? But not everything about your care, right? And so that way they're also understanding of that, and don't have to wonder where, well, if is my social worker going to know everything that I'm going through, right? Is this other person going to know exactly my diagnosis, right? So making sure that we build that communication, that we build that trust and those boundaries, and that they understand what that means and what information is allowed to be shared with each of these disciplinary teams, right, is really important, so that way we don't break that therapeutic alliance and trust.
Yeah, I agree. And kind of to add on to that, just like how you were saying that it's important that you as a therapist understand what the client understands. I think it's also important that as a therapist, we are also asking kind of the client what they would want to share and are, what they feel comfortable sharing. Obviously, we do have limitations as like, if, self-harm or something like that is involved. But I do think that having the client maintain their autonomy is super important, just for the therapeutic alliance, um, and just for the client to feel that safe and trust in the therapy room with us. Um, and overall, yeah, just how everyone else was saying, I think those clear boundaries and clear roles of what everyone can and should have access to is just going to be the best approach for the client, and to make sure that the client is always at the forefront of kind of our thought of what we are sharing and what we're not sharing, as per their information.
Thank
So
you.
thank
Thank
you.
you.
Thank you.